Gonzalez.
Morning, doctora.
Hi, my name is Glency. I'm your nurse practitioner today. We're gonna do your assessment. So let me know what is your reason for your visit?
I come in for my annual check.
For your annual physical exam?
Yes.
Oh, okay. Can you tell me your complete name and date of birth?
Juan Carlos Gonzalez, October 31, 1977.
Oh, very good. And do you know where are you?
Medical facility in Tampa, Florida.
Oh, good. And what date is today?
Today is Friday, February 7.
Okay, very good. So just by answering these questions, I can tell that my patient is alert and oriented times 4. So he is in a very good appearance. He make eye contact, able to articulate words, and his posture is very good, straight up, and his facial features are symmetrical. So we're gonna do your vital signs, okay? Do you have any allergies?
No.
No medical allergies?
No.
And do you have any pain right now?
No.
Any pain? Okay, good. Put your hand here, please. All right, very good. 118/72. Good blood pressure. So let's check your oxygen saturation and your pulse and your temp. Good. Very good. So since my patient has very good and stable vital signs and he has no signs of distress or discomfort, we're gonna go ahead and do your head to toe assessment, okay? So I'm gonna ask you to sit on the bed.
Okay.
Okay, let's wash my hands, put my glove on, and we're gonna go ahead and start with your head to toe assessment. So we're gonna start with your head. Let's check your head, excuse me. Okay. It's round and symmetrical, no lumps or anything noted. We could say that it's normocephalic to shape. So now let's check your hair. Hair is clean and abundant, no lost hair noted, and no signs of alopecia observed either. Okay, now we're gonna do your eyes. Let's check out your eyes. Just looking at my patient, I can see that his pupils are equal bilaterally and round, and we're gonna like to check for accommodation and reaction, okay? First, we're gonna check reactive to light. Let's see if your pupils are reactive to light. Very good. Yes, pupils are reactive to light bilaterally. Now let's check for accommodation. Please look at it here and follow it. Yes, pupils are reactive to accommodation. They accommodate properly bilaterally. Okay, very good. Let me check the conjunctiva. Conjunctiva are pink bilaterally and sclera is white. So very good so far. Let's go with your ears. We're gonna check, inspect outside the skin, no skin breakdown noted, no redness, no lumps, no secretions observed in any of the sides, any skin breakdown, no skin breakdown behind the ear. Now let's check inside. No sign of redness, no inflammation, no secretion. Very good. Do you have any ear pain or something?
No.
Do you use a pool and swim around very frequent or so?
No.
Not really? Okay. So now to check your nose, I'm gonna ask you to tilt your head back, please. Let's check inside. No sign of redness, no sign of inflammations or bone deviation. Have you had any trauma to your bone nose?
No.
Not before? Do you have any problem with your sense of smell?
No.
Very good. So, can you breathe normally through your nose?
Yes.
Okay, can you block one of your side and try to inhale? Now the other side, please. So my patient has very good airway and no blockage or obstruction noted to his nose and breathing through his mouth, through his nose. Now we're gonna go ahead and check your mouth, okay? Open up, please. Very good. Okay. Mucosa gums are pink and moist. No any signs of loose teeth or nothing abnormal. His lips are moist, well hydrated, no cracks or anything. Observe, not really dry at all. Let me check here. Open and close your mouth, please. Yes, very good occlusion here. Let me check now the range of motion of your neck. Do you have any neck problem when you're sleeping or so?
No.
Can you move side to side, around, open to the front and then to the back? Very good. Okay. Now let me check the carotid pulse. They are close to bilaterally. Now we're gonna check if he has any bruise in his carotid pulse, okay? Okay, no bruise noted. Okay, now we're gonna go ahead and do the part of your abdomen and your chest first, and basically the respiratory part and your heart, okay? So by this time, we're gonna observe the patient's chest is bilateral, equal, and uniform in color, and it is symmetrical. So he has no really anything that we can observe from outside that it could call our attention for something. So usually when we're gonna do this assessment, the patient should be kind of bare skin or something that we could open and place the stethoscope directly to the skin. But in this case, for privacy purposes, we're gonna leave him like that, okay? So we're gonna start, Mr. Gonzalez, doing checking your respiratory sounds, okay? I'm gonna listen to them with the diaphragm side of the stethoscope. And you're gonna breathe in anytime I change the position of the stethoscope, please. Okay, the anterior part of the chest, it seems clear to occultation with no adventition sound here. Now we're gonna go with the posterior part of the chest. Same thing. Okay, long sounds in my patient are clear to auscultation with no adventition sounds here. Do you have any respiratory issues, any shortness of breath? Have you suffered of asthma or any other kind of respiratory thing before? No. Okay, very good. Now we're gonna go ahead and do the heart assessment, okay? So, by this side, you can breathe normally for this assessment, okay? Very good. Now we're gonna use the bell of the stethoscope to see if we can find any murmur or extra sound. The same, you keep reading normally, is the same assessment but with the bell of the stethoscope. Okay, very good. S1 and S2 are regular, no murmurs or extra sound here in auscultation. So now, same for here, we're gonna check your skin, extend your arms here. Skin is warm to touch, even in color for his ethnicity. No tinting, let me see for some kind of signs of dehydration or so. No scars, no mold, no lesions at all. Let's check radial pulse here. Okay, radial pulse is present, +2 bilaterally. We can check capillary refill too. Capillary refill is even and equal, less than 3 seconds above. His hands are clean, nails are short, clean, and in a very good condition. Let's check for clubbing. Can you put your nails like this, please? No signs of clubbing noted because the patient doesn't have any respiratory disease or so. Now we're gonna go ahead and I'm gonna ask you to lay down, please. Okay, Mr. Gonzalez, now we're gonna go with your abdomen and your apical pulse. Let me get my glove on. Can you uncover your chest, please? Good. So the first thing we're gonna do here is to check your apical pulse for 1 full minute. That way we make sure and everything is okay with your heart. One full minute to check apical pulse. Okay, very good. The apical pulse is regular and is 72 beats per minute. Now we're gonna do your abdominal assessment. We can check his abdomen. He has no bloated. His umbilicus is midline. No any lumps, inflammation, or anything noted. His abdomen is flat and symmetrical, so it has a good shape. Now we're gonna check your bowel sounds to see they are present in all 4 quadrants. Okay, bowel sounds are present in normal, active in all 4 quadrants. Now I'm gonna palpate just a little bit. Do you feel any pain?
No.
Have you had a bowel movement every day?
Yes, I go every day.
It's normal, that's your regularity?
Yes.
Okay, now we're gonna check the aorta, okay? To see if we can listen to any bruit. No bruit noted. Okay, now I'm gonna ask you please cover back your chest and bend your knees. Córtalo. Okay, Mr. Gonzalez, please, can you remove your shoes and bend your knee, please? Oh, thank you. I'm gonna check the pillow pulses and the pillow pulses and the post-tibial pulses, okay? Let me lower your socks like this. Let's see here. Okay, pillow pulses are +2 bilaterally. Let's go and check the post both tibial pulses are close to bilaterally. Since the patient is, so we're checking down here, bilateral lower extremities are even in color, warm in touch, and he has no edema noted. No edema, hair growth is normal, so with that, we're ruling out any kind of peripheral vascular disease problems, which he doesn't have any. Now I'm gonna ask you to sit up, please. We're almost done. I know it's kind of pretty long. We're gonna do and check the strength of your extremities. We're gonna go ahead and bend your elbows like this. Very good. Push in, push in. Towards you, very good. Towards me. Now push in and push out. Very good. Now we're gonna do the same thing with your bilateral lower extremities, okay? Push in, good. Push out, toward me, and towards you. Oh, very good. So our patient, great. My patient is 5 out of 5 muscle strength on bilateral upper extremities and bilateral lower extremities. We are basically complete. We're done with your skin assessment and with your head to toe assessment. You seem in a very good condition and your health, it seems pretty good. So I would like to ask you, have you had your flu vaccine this year?
Not yet.
Not yet? Well, we can offer it to you. Would you like to have it here today?
Yes, please.
Very good. So another thing about you and your health, how you come basically once a year. I could recommend you to do some labs just for routine. And I'm gonna give you an order for those, and you go to the lab, do them, and they will send me the results, and I will call you if we find any abnormality or so, okay? Other than that, the medical assistant, she will come to do your vaccine, and we're done for today, okay? Thank you for coming.
Thank you.
Sure.